Hey everyone! So picture this. You wake up with a splitting headache. Maybe you overdid it at the gym yesterday, and your back is killing you, or perhaps you're dealing with that annoying fever that just won't quit. What's the first thing most of us reach for? That familiar brown bottle with those little brown pills, Advil. But have you ever stopped to think about what's actually happening inside your body when you pop one of those pills? Today, we're going deep into the fascinating world of one of the most popular pain relievers on the planet. Trust me, by the end of this video, you'll never look at that little brown pill the same way again. We're going to uncover some surprising truths about how Advil works, why it became such a household name, and, most importantly, how to use it safely and effectively. Let's start with something that might blow your mind. Advil wasn't always available at your corner store. In fact, the brand first entered the American market in 1984 through Whitehall, the same year ibuprofen gained FDA approval for over-the-counter sales in the United States. Before that, you needed a doctor's prescription to get your hands on this stuff. Wyeth made history in 1984 with the introduction of Advil, the first non-prescription ibuprofen in America, as well as the most famous prescription to OTC switch in history. This wasn't just a small business decision. This was a game changer that would revolutionize how we deal with everyday pain. But here's what's really interesting about Advil's rise to fame. It wasn't just about the medication itself. It was about timing and marketing genius. When Advil hit the shelves in the mid-'80s, people were already familiar with aspirin and acetaminophen, but they were looking for something that worked differently, something more effective for certain types of pain. Advil filled that gap perfectly. Today, Advil is the #1 selling over-the-counter pain reliever in the United States. And it's not hard to see why. The brand has built trust over decades, and when you're in pain, trust matters more than anything. Now, before we dive into the nitty-gritty science, let's get one thing straight. Advil is essentially a brand name for ibuprofen. Ibuprofen is a non-steroidal anti-inflammatory drug, or NSAID. But calling it just an NSAID is like calling a Ferrari just a car. Technically correct, but it doesn't tell the whole story. The active ingredient in Advil is ibuprofen, and depending on what you're buying, you're getting anywhere from 200 mg to 800 mg per dose. But here's where it gets interesting. Ibuprofen isn't just one molecule doing all the work. It actually comes in two mirror image forms, called enantiomers. The S enantiomer is believed to be the more pharmacologically active enantiomer, meaning it's the one doing most of the heavy lifting when it comes to pain relief. Your body is incredibly smart, though. The R enantiomer undergoes extensive interconversion to the S enantiomer in vivo. In simple terms, your body takes the less active form and converts it into the more active form, making sure you get the maximum benefit from every pill. All right, this is where things get really fascinating. When you swallow that Advil pill, you're essentially sending millions of molecular soldiers into battle against pain and inflammation. But how exactly do they fight? At a molecular level, ibuprofen works by inhibiting the activity of cyclooxygenase enzymes, specifically COX-1 and COX-2. Now, I know that sounds like a mouthful, but stick with me because this is where the magic happens. Think of COX enzymes as tiny factories in your body that produce something called prostaglandins. These enzymes play a crucial role in the synthesis of prostaglandins, which are lipid compounds that mediate inflammation, pain, and fever. Prostaglandins are like your body's alarm system. When you're injured or fighting an infection, they ramp up production to create inflammation, pain, and fever as protective responses. But here's the thing, sometimes this alarm system goes overboard. That's where Advil comes in. After a physiological or pathological stimulus, membrane, phospholipids release arachidonic acid through the actions of the enzyme phospholipase A2. This arachidonic acid then feeds into the cyclooxygenase pathway, creating those prostaglandins that make you feel terrible. Ibuprofen is a non-selective COX inhibitor, and hence, it inhibits the activity of both COX-1 and COX-2. By blocking these enzymes, Advil essentially turns down the volume on your body's pain and inflammation signals. It's like having a really good sound engineer who knows exactly which knobs to turn to make everything sound better. Now, you might be wondering why Advil seems to work better for some types of pain than others. The answer lies in understanding what causes different kinds of pain and how Advil's mechanism addresses each one. For headaches, especially tension headaches and migraines, The pain often comes from inflammation in blood vessels and surrounding tissues in your head. Ibuprofen works by blocking certain substances in the body that cause pain, inflammation, and fever. By reducing this inflammation, Advil can significantly reduce headache pain. For muscle and joint pain, say after a tough workout or when you're dealing with arthritis. The story is similar, but even more dramatic. When your muscles or joints are damaged or overworked, your body floods the area with inflammatory substances. This inflammation is actually part of the healing process, but it also causes pain and stiffness. Advil steps in to reduce this inflammation, giving you relief while still allowing your body to heal. For fever, the mechanism is particularly elegant. Fever is caused by prostaglandins, affecting your brain's temperature control center. By blocking prostaglandin production, Advil helps reset your internal thermostat back to normal. Here's something most people don't realize. Timing can make or break Advil's effectiveness. It is usually taken 3 or 4 times a day for arthritis, but for acute pain, the strategy is different. The best time to take Advil is actually before your pain peaks, if you can predict it. For example, if you know you get headaches in the afternoon, taking Advil in the late morning can prevent the pain from ever reaching its full intensity. This preemptive approach works because you're stopping the inflammatory cascade before it gets fully started. For post-workout muscle soreness, taking Advil within an hour after exercise can significantly reduce the inflammation. That leads to delayed onset muscle soreness. However, there's a catch here that most people don't know about. Some research suggests that taking anti-inflammatories immediately after exercise might slightly impair muscle adaptation and growth. So if you're trying to build muscle, you might want to wait a few hours before reaching for that Advil. Morning is generally the best time for your first dose if you're dealing with chronic conditions like arthritis, because inflammation tends to be highest when you wake up. Your body's natural anti-inflammatory hormone, cortisol, is lowest in the early morning, so giving it a boost with Advil can set you up for a better day. Now let's talk about who can benefit most from Advil. The ideal candidates are healthy adults dealing with acute pain, inflammation, or fever. If you're an active person who occasionally deals with workout-related soreness, headaches, or minor injuries, Advil can be incredibly effective. Athletes particularly benefit from Advil because it addresses both pain and inflammation, which are the two main culprits behind exercise-related discomfort. The anti-inflammatory properties help reduce swelling in joints and muscles, while the pain relief allows for better mobility and faster recovery. People with chronic inflammatory conditions like rheumatoid arthritis or osteoarthritis often find significant relief with Advil, though they should be working with their healthcare provider for long-term management strategies. But here's where we need to pump the brakes. Advil isn't for everyone, and some people should definitely avoid it or use it very carefully. If you have a history of stomach ulcers, kidney problems, or heart disease, Advil can potentially make these conditions worse. The same QX enzymes that Advil blocks also produce protective substances in your stomach lining and kidneys. Older adults need to be particularly careful because they're more susceptible to both stomach and kidney side effects. If you're over 65, you should definitely talk to your doctor before making Advil a regular part of your pain management routine. Pregnant women should avoid Advil, especially in the 3rd trimester, as it can affect the developing baby and potentially complicate delivery. If you're breastfeeding, small amounts of ibuprofen do pass into breast milk, though it's generally considered safer than many other pain relievers. Getting the dosage right is crucial for both effectiveness and safety. Ibuprofen is available in 100 mg, 200 mg, 400 mg, 600 mg, 800 mg oral tablets. For most adults, the over-the-counter recommendation is 200 to 400 mg every 4 to 6 hours as needed, with a maximum of 1200 mg in a 24-hour period, unless directed otherwise by a healthcare provider. Here's a pro tip that most people don't know. Taking Advil with a small amount of food can significantly reduce stomach irritation without affecting its effectiveness. You don't need a full meal, just something to coat your stomach lining. The duration of treatment is just as important as the dose. For acute pain like headaches or minor injuries, you typically shouldn't need to take Advil for more than a few days. If you find yourself reaching for it daily for more than a week, that's a sign you should talk to a healthcare provider about what's causing your pain. Until next time, take care of yourselves